Hello, I'm Sarah Barker. I'm a nurse and I have developed a microneedling device. So today's training is on the process of microneedling and also an introduction to the Flawless Pen microneedling device. So we will be going through the history of microneedling, the goals of skin rejuvenation, needling compared to other popular therapies within the health, wellness and beauty industry. We will look at using topical products, so skincare creams with it, how it affects common skin conditions, and synergistic modalities, so things that you can use in conjunction with microneedling. We'll look at the basic protocols and how you can package and sell the packages to your customers. So what is skin needling? So needling is needling the skin in depths of 0.5 to 3 millimeters. And it uses very fine non-surgical needles to sorry, I'm just setting my timer up because I'm doing this for my exam presentation. Stopwatch. So unlike lasers, it doesn't cause any heat damage, and unlike chemical peels, it doesn't cause any chemical damage. It's literally just very fine surgical steel needles going in and out of the skin that are causing a minor type injury to the skin, and then therefore the skin releases growth factors. So it promotes scarless healing and the deposits of normal woven collagen rather than scar collagen. So this is the healthy collagen that we need in our skin. It allows 80% more product into the skin. So if you are using it with topical products such as retinol, vitamin C, serums and anti-aging serums and things like that, it will penetrate the skin much better after a session of microneedling. So the history, it's been around since about 1995. A gentleman called Trek used to use it for helping with indented scars, where he would use a surgical needle to go in and out of the skin. And this would cause breakdown of the tightly knit collagen bands of scar tissue, and replace that with healthy collagen. So this was in 1995 and it was only done by doctors. So following on from that, sort of in the late 90s and the early 2000s, it was done in a lot of dermatology clinics, and then it's rolled out into the beauty industry. So there are a lot of the beauty industry that are using the traditional rolling method, so rollers with needles all the way around the drum, to go in to roll up and down the skin, to make the little micro injuries, and then using face creams and serum. So I'm just going to look at some treatment comparisons here. I don't know if you can see that very well. So I'm talking about a device called the Flawless Pen. So this is a pen device where the needles come in and out at very high speeds to penetrate the skin. So unlike the rollers, you use a pen device and the needles go in and out all over the surface of the skin that you want to treat. You can treat the face or anywhere on the body. So in comparison to, does it improve skin texture? Yes, it does. Does it improve scars? Yes, it does. Does it increase skin permeability? Yes, it does. Is there a risk of hyperpigmentation? No, there's very minimum risk. So compared to chemical peels, where there is some only minor improvement in the scars and there is a risk of hyperpigmentation, the same with laser and the same with microdermabrasion, it's actually a safer alternative for you to use in your clinics and salons against these other and often more expensive treatments, because if you buy a laser it can cost thousands and thousands of pounds, whereas if you do microneedling it can cost from as little as £15 per treatment. Treatment shouldn't be carried out 2 weeks either side of an aesthetic treatment. So for example, an injection of Botox, dermal filler treatments, other chemical peels, although in more advanced training to this we will talk about how chemical peels chemicals can be used with microneedling to improve the skin texture. So a diagram of the skin, we're looking at different depths of the skin, so different depths reach different cells. So if you're looking for to get the keratinocyte layer, you're looking at very low depths of the skin, up to the 0.3 millimeters. If you're wanting to go for cellulite or deeper scar tissue or things like stretch marks, you're wanting to go a little bit more deeper into the dermis. So it is important that you do know your skin anatomy before commencing microneedling. So the basic goals of skin rejuvenation are to reduce fine lines and wrinkles, and to also improve the texture and the tone and the brightness of the skin. And microneedling is very successful in increasing these benefits for our clients and our customers. So we want people to be pleased, we want repeat business, so we want to carry out a good thorough treatment. So we recommend a double cleanse of the skin, and talking to your clients about the products that you're using on the skin. So talk about the benefits of the skincare that you're using. Is it a botanical skincare range that you're using, or is it a chemical skincare range that you're using? And if you don't know the difference in the sort of cosmeceutical, cosmetic grade skincare, then we can also talk about that in the training, on this training, or on any of the other courses that we offer. We want to optimise the cell function, and the way in which we do this with microneedling is going back to the diagram of the skin. Depending on the depth of the skin that you're treating, would depend on what cells you're targeting. So keratinocytes, our skin is made up of 90% of keratinocytes. So they are the very surface of the skin. They are the dead skin cells, the skin cells that are dying off. But if we stimulate them, if we micro injure them, then they can send a message cascade to cells that are deeper than that. Melanocytes are the cells that cause pigmentation, so the cells that can cause pigmentation in hormonal changes like pregnancy mask, melasma that's caused by the pill, and that sort of thing, so hormone imbalances, but also solar damage, so sun damage, freckles, things like that. So anything that affects the pigment or the skin colour, we would be targeting the melanocytes. Now fibroblasts obviously are what we need to stimulate for the collagen production, and collagen production decreases when we get into about our 30s to 40s and goes down and down and down. So the better ways that we can find to increase and stimulate these interesting skin cells, the better. So we want to improve the epidermal density and the smoothness. The keratinocytes are responsible for releasing the key growth factors. So these are the messengers that will send messages to our skin cells, and therefore to our brain, to produce more or less of something. So microneedling eliminates the risk of heat injury and optimises the cell production. So this is the same for the fibroblasts, the melanocytes, the keratinocytes, and even the sebum secreting cells. So even things like acne, where there's an overproduction of sebum, microneedling can actually decrease our output. So topicals, what we use in the demonstration of the microneedling is we use hyaluronic acid. And hyaluronic acid, the one that comes with Florus pen, is 3,000 daltons, which means it holds 3,000 times its weight in water. So it's very hydrating and bathing for the cells. And we're actually not needling that into the skin. So it enhances our treatment outcomes. So I don't know if you can see these before and after treatments, but it actually gives a better result if you've used the hyaluronic acid. We can also use things like retinol, so again a very anti-aging skin skincare ingredient. Vitamin C, a very brightening ingredient. And we've got some biopsies here of old versus younger skin. So older skin, young skin shows thick, tight bundles of collagen, and aging skin, it gets looser and it goes baggier, and hence it leads to saggier skin. So microneedling can help stimulate and tighten all those collagen bands right back up again. There's also the little micro channels. So like I say, if you put anything on topically after you've done microneedling, for about 8 seconds after a microneedling, if you can pop on the hyaluronic acid, which is holding all that weight in water, it's really a good way of bathing the cells and adding hydration to the skin, which, as we know, is very, very beneficial in our industry. We can go on to talk about the dermal and epidermal junctions, so things that come out of our skin, so we can excrete waste and toxins from our skin, but again, we can also be putting beneficial things back into our skin. Like I've spoken about before, we can break down scar tissue and replace that with healthy skin. It can treat scars and stretch marks, again by replacing with healthier collagen bands. And we can release natural growth factors. So not only does microneedling release our own natural growth factors from the skin of the client that you're treating, we can also put in growth factors. So there's skincare serums that contain growth factors, but there are also things like PRP, platelet-rich plasma systems that we can use, that you can also microneedle back into the skin. That would be obviously a separate training course, but we also offer training on that. So we increase natural collagen, which, like I say, slows down when we get to a certain age. It's hard to prescribe what depth you would use on each individual person, because people have different thicknesses of skin. So an older lady with quite dehydrated skin may need a deeper level of microneedling, so anything from 0.5 to 1 millimetre, than somebody in their mid-40s like myself. I would probably only need a depth of 0.25 to 0.5. So you need to make sure that you're very thorough on your assessment. You need to check out their skin condition first, and also do a thorough assessment, take into account age, sun damage and that sort of thing, depending on the depth, and we'll go through that in the practical element of this training. So we don't want to be overstimulating the skin either, because we don't want to be thickening the skin too much. So I would recommend doing a treatment of at least 4 weeks apart, because our skin cycle takes about 4 weeks to do a full skin cycle. So I wouldn't be microneedling anybody before a cycle of 4 weeks has taken place, unless you were building up tissue. So if you've got a pitted acne scar and you're wanting to build that up in line with the rest of the skin, then you could go as quickly as every 2 weeks, because you're wanting to build that collagen up. Unless you're wanting to build collagen up, I wouldn't needle anybody any more frequently than 4 weeks apart. We have some great results with before and afters of acne scarring. Again, that's one of the deep scars that you would be wanting to build up. So these would be the only skin types that I would needle for any more frequently than 4 weekly apart. Here we have a pitted, it was a pitted chickenpox scar that we've built up, and that was after 3 weeks, and that was just one treatment. Anti-aging on the neck. As you can see, this crepey neck was a lot more hydrated after just one treatment, and that was at 0.5. So in a separate training, we will do the practical about the Flawless Pen device, and I hope you've enjoyed this training. This was just wanted to talk on camera. This is different to a normal classroom environment because I'm doing this for my teaching certificate, and I will be running lots more courses in skincare, on makeup application, and also, like I say, on PRP and various other treatment modalities that you can use with microneedling. So I hope you enjoyed this presentation. Thank you very much for watching, and please stay tuned as I will put this on my YouTube channel. Thanks very much. Bye.